I am Dr. Zeshan. I'm a board certified child and adult psychiatrist. Recently, I have seen a really interesting patient where a middle aged man came to me and telling me that he was diagnosed with ADHD in his childhood and was using Ritalin for a couple of years, and then later in life he learned how to cope with his ADHD symptoms. So he did not have to use those medication that often. And I think somewhere in his 30s, I believe, he restarted using the medication here and there. And then he got this idea to freeze his ADHD medication. So he came to me like in his late 60s and shared that he has this prescription of Ritalin being frozen for almost 10 years, and he has been using this half a tablet or even less whenever he needs to. And recently the reason he came to me is because he was going through some difficult time, like a lot of unpredictability. There are a lot of changes in his schedule, and also he's moving to a new house, a lot of things that he realized that his ADHD is really kicking in. And then he recently also read an article that people who have ADHD, and if they don't and if they regularly take medicine, it can help their cognitive ability as well. So anyhow, he came to me and asked me that can he get a prescription for ADHD. So I went over his history, talked to the family members as well. Yeah, so it was pretty clear that he has the ADHD diagnosis, and because of these recent changes in life, he has been going through with the paying attention, need reminders, for forgetfulness, and lot of executive functioning issues. And I thought because he was using the medication, and Ritalin worked for him, so I agreed to prescribe the medication. But I asked him why it was so hard for him to reach out to a psychiatrist for so long. And he mentioned he was very ashamed, and he was very hesitant to, and he was not sure what people will think about freezing this medicine, and how people judge him for using this frozen medicine. So what I learned is that a lot of time sometimes the shame, the guilt, and being judged, it may paralyze us, and it may prevent us to seek the the follow up, the treatment that we need. So I really encourage my viewer to if you are going through some difficult time, and if you realize that you need some help, I will encourage you to reach out to mental health professional right there and then, and share your thoughts. And if you have a diagnosis of ADHD, and if you are taking some medicine, so, and if you are not taking it, or for some reason have been overusing it or underusing it, it's important to discuss with the mental health professionals so that they can guide us, they can help you what is the right way to restart taking the medicine, what dose you can take, because sometimes you might be taking higher dose when you are younger age and know many years have passed, and now you wanted to restart again, but the same dose that was working for you before, if you take it after so many years, you may notice some the side effect. So it's important to consult your psychiatrist, your primary care, and discuss rather than just adjusting the doses yourself, or freezing your medicines, or finding other ways to cope with your ADHD when that something have worked for you and there is help out there. So please don't hesitate to reach. Don't let this being afraid what other people think let you in way to get professional help. Thank you.